opinion, how do you think that India responded to the challenge?
This has become a global problem now. Almost 5 to 6 billion people are already affected by COVID. In case of India, this problem is actually more acute. Our economy is going to contract by almost 23.9%. And if we can see, most of the countries were not really well prepared. They did not have the capacity for taking care of the critical patients. There was no national policy in place. There was panic all around. We did not have adequately trained healthcare providers, doctors, clinicians, technical staff. We did not have adequate ventilators. So there was a panic initially before the world could fathom the actual impact of this pandemic. And then India slowly started opening its economy. So first 2 quarters of the current financial year were totally washed out as far as the businesses were concerned. So the hospital businesses also went down to as much as 25 to 30% of their pre-COVID top line, which now slowly is bouncing back and recovering. Healthcare is one of the recession-proof industries. But unfortunately, since the pandemic hit, the providers also, and in a bigger way, the patients had that, lingering doubt or fear of infection while visiting the hospital. So a lot of elective surgeries were put off, which amount to millions of surgeries and consequently billions of dollars worth of revenues, which was lost.
Yeah.
Similarly, India is also one of the major players in medical value travel. The size of the market is anything between $3 and $6 billion. We were getting a lot of patients from Africa, Middle East, and some of the SAARC countries. And that flow of the patients has stopped, which also contributed significantly to the top line of some of these healthcare providers. So because of the lower revenues, most of the healthcare providers have faced major problems in working capital management. See, today in the hospitals, the working capital available is not more than 1 month, 20 to 25 days to be precise. Pandemic lasting such a long time and the business recovery taking such a long time, almost, we are in the close to third quarter. The hospitals have just been able to recover to 45 to 50, 55% of their pre-COVID revenue, which is not even adequate to pay their manpower, vendors, and the other business partners who are supplying you all the consumable drugs and implants.
Mm-hmm.
So one, the policy needs to be worked out at the national level to deal with such pandemics. We need to create capacity in terms of critical care, in terms of trained staff to deal with such pandemics, and also invest adequately to manage such a criticality at short period of time.
So let's just go back to cash management. How does a hospital then continue through a lockdown to be sustainable?
Yes, Kay, very good question. Unfortunately, most of the hospitals, especially the smaller hospitals, do not have the wherewithal to last this kind of a cash crunch for many, many months together.
Yeah.
So hospitals typically, have their business structure in such a way that 70% of the business is cash patient driven and 30% is credit business. Typically, I'm talking about a multi-super specialty hospital in a bigger city.
Mm-hmm.
It would have about 70% walk-in patients who come and pay in cash, so that cash is readily available to meet your working capital requirements. But 30% is through the credit business, with typically the insurance companies, which we call as third-party administrators in India, HMOs in some of the other markets. Then also some of the private and public corporates. So patient would come in a cashless treatment, take treatment from the hospital, go back. We are required to submit the bills and the money will come after a few months. Typically, it can take anything from 90 to 120 days to realize that money. And at times, there are deductions from that, anything from 5 to 10%. So it's a major problem. You lose your 30% of revenue until 3 to 4 months later, and you have a pandemic in which you are not generating enough through your cash paying patients. So most of the hospitals have gone either on cost optimization initiatives, which essentially meant taking a hit on your salary, and also in certain instances reducing some of the outsourced services and optimizing on your existing teams. In the absence of which it would be extremely difficult to stay viable, and also to meet whatever shortfalls are there, take additional debt from the banks to keep your operations going.
Moving forward, are we going to see closures of hospitals?
In the current quarter, there are green shoots. There is a recovery, and slowly there is definitely a progress. Obviously, the patient cannot stay too long away from the hospital and keep postponing those elective surgery. They have to undergo coronary bypass surgery if it is a requirement and if it is going to have an adverse impact on the patient's health. So far, we have been treating only emergency cases, but slowly the patient has started coming back. That initial panic or fear of contracting this disease has gone out of the minds of the treatment seekers, and patients are again coming back to the hospitals. So revenues are also slowly bouncing back, and we hope that by the end of the next year we would be somewhere closer to pre-COVID revenues. Till then, you have to manage. Obviously, there are certain business entities which will go out of business for sure, and we are going to see a lot of consolidation also in the coming months and years.